right. Hey, everyone. I'm Melanie, and today on Flow with Solaris, I'm sitting down with Natalie Gripper. She's the creator of KinRe, which stands for Kinetic Relaxation. And Natalie is a biokineticist out of South Africa who's been in private practice since 2000. And she developed something really fascinating. KinRe is what she calls the anti-exercise. It's a science-based movement method that works within your comfort zone to reset your nervous system and to release tension and to basically help you heal your body. She's helped people dealing with everything from chronic stress and back pain to post-chemo recovery. And now she's made it available to anyone online. So, Natalie, I'm so glad that you're here. I'd love to start with your story. So, can you tell me how you got into this work and what's the kind of person that you help?
Thank you, Melanie. Thank you for having me on, and hello to the listeners. So, I've been in movement and some kind of sport all my life, a bit of a jack of all trades. And I then later in life went to study biokinetics, and I qualified in 2000. And I've been working in biokinetics ever since. So biokinetics is basically a clinical exercise specialist. And if you break it down, bio is human or the body, and kinetics is movement. So KinRe, kinetic relaxation, is an extension of that in a way.
So, what led you to develop KinRe? Was it there? Was there like a moment or an experience that sparked the idea combining kinetic movement with the nervous system relaxation?
Yeah, it's a bit of a funny story actually. So I got asked to work in a mental health clinic,
Mm.
and I was my job, my task was to give the patients exercise. But everybody's perception of exercise, or most people's perception of exercise, is go hard or go home.
Yeah.
So the inpatients had that perception. And in the little gym room at the clinic, there was a bicycle, a stepper, and a multi-gym, and a couple of big Pilates balls. And so I'd bring them in one-on-one, and I always found myself having to slow them down, saying you don't have to exercise at your max to feel any benefit. And please don't,
Yeah.
because these clients are now in the clinic because of highly stressful situations,
Mhm.
traumatized, and that kind of thing. And so I wasn't happy with the way the clinic presented the exercise. There's a little gym, go exercise the clients. I felt they needed something a little bit more calming
Mhm.
and something that they can feel, because also they're on a lot of medication, and that can sometimes make you numb.
Wow.
So I decided to work in a class group. We moved to the lounge in the clinic, and they had sofas and ottomans.
Yeah.
So I got everybody to sit on an ottoman each, and I took them through very slow movement, because also it reduces the risk of injury greatly.
Mhm.
When you're bouncing around, you could hurt an ankle or a knee or something like that. So I needed to also reduce the risk of injury quite drastically. And I started a couple of sessions, and I recorded how they were feeling prior to the class and how they were feeling afterwards. And the difference was incredible. And I thought, okay. So I carried on with this method of exercise over the next couple of years. And And then I was, I realized what it did for me.
Mm.
You know, it calmed me down. I wasn't reacting to stresses the way I usually reacted. So I thought, well, if it does that for me, and I was in a highly stressful situation at the time, if it does that for
Mm.
me, how can I take this to the public? So I tried it with the public, and the feedback was great.
Yeah.
And so then I thought, okay, let me research this a little bit and see how I can package it with a name and everything. And so I went back to the books
Yeah.
and came up with Kinetic Relaxation. So KinRe is the combination of kinetic, kin for kinetic, and re or re for relaxation. Yeah.
So you took something that came to you and you packaged it up, and now you can teach others how to teach others. And
Yes.
oh, that's so cool.
Yes.
And
Yeah.
you call it the anti-exercise. And can you explain what that means? Why working within the comfort zone is so powerful for people?
Okay, so it's anti-exercise because of people's perception of exercise.
Mm.
We are fed high profile football games, soccer games, cricket games, rugby games, and so the perception out there is if you go to the gym or if you must exercise as the doctor prescribes, they just generally say, go and do some exercise. They think they've got to go full out, be totally exhausted by the end of the session, vomiting and sweating and completely out of breath.
Yeah.
That just increases the cortisol levels in the body because you're putting yourself in a highly stressful situation. So I, because KinRe is not sweaty, it's very slow, mindful movement.
Mm.
Although it's movement, it's not exercise as people generally perceive it to be. So that's why I called it anti-exercise. You don't get out of breath. You're not sweating. You don't need specific gym clothes. You can
Mhm.
just use the clothes that you are comfortable in, and and enjoy the moment.
Yes. And
Yeah.
you're getting that chi going in your body. Is it similar to qigong or totally
Well,
different?
the great thing about KinRe is I have never done a Pilates class.
Hmm.
I've never done a yoga class. I don't know anything about Qigong or Tai Chi or anything like that.
Mhm.
So, and I didn't want to go in and have a look. I
Yeah.
wanted it to be totally unique and my version based on the results of the patients in the clinic and my public patients. I wanted it to be just totally unique and my version of a method to relax and reduce stress.
I love that. I think that's how like some of the best inspiration comes in. It's like you put your blinders on and you're like, what am I receiving here? And so
Yeah,
there's like such a purity in it. And I can totally relate to that. And you've seen people recover from everything from chronic pain to post chemo fatigue using this method. Can you share what that transformation has looked like for someone?
I've also used it for cardiac rehab in patients or
Uh,
with patients. So
mhm.
patients who have had heart bypasses, stents, TAVIs, um, and what it looks like. it looks like the patients come in with color in their face.
Mm.
They are moving better. Their posture is much better. So as a result, it their body aches and pains have reduced, and especially in between chemo sessions. Mainly, I've mainly worked with patients who are at the end stages of their chemo,
Mm.
and most of them, well, all of them, report that their recovery time between sessions is so much quicker. So where immediately after a chemo treatment, you would take a week to feel semi-whole again,
Yeah.
and then you've got a week of normality before you start your next chemo. They were feeling a whole lot better or more normal 2 to 3 days after their chemo
Wow.
treatment. So, yeah, so it's all been positive and so good, and it's wonderful.
Yeah, it's like rebuilding their life force in a gentle way, but gentle not meaning weak at all, a very powerful way.
Absolutely,
Yeah.
absolutely. So the physics behind KinRe, um, the kinetic relaxation part, that's when they test the strength of a substance like concrete to find out how strong it is.
Hmm.
So they heat the particles up, and then they let the particles settle, and then they test the strength. And that's exactly what we're doing in KinRe.
Wow.
We are warming up the body, getting the particles to flow in combination with your breathing. And then in the relaxation part, we settle, and then we determine how well our bodies have healed. And in that way, we grow stronger.
Wow.
And we become emotionally more resilient,
Mm.
because you don't have to think about your reaction to stresses when you do KinRe. It just automatically happens.
Wow. This is a paradigm shift because
It is.
we
It
think that
really
it
is.
has to be hard to get results. We have to struggle, but this is what's available to us. We don't need to
Yes,
struggle so hard.
exactly. And so working in your comfort zone in KinRe, we're always exploring the boundaries of our range of movement.
Hmm.
So when if you come in, say you've got a patient with arthritis,
Hmm.
or and they've got arthritis in various joints of the body. If you just get them to explore the range of movement in their joint,
Hmm.
and they do it consistently, that range of movement eventually improves because they feel totally comfortable. You're telling the body that it's safe to move. And in that way, we're bringing our systems down into parasympathetic activation, which obviously draws the blood to the gut,
Hmm.
and then your digestive system starts working properly. The circulation, because of the movement, starts working properly. So every bit of nutrition or nutritious food that you eat, that gets taken up and transported through the body. And it's very well documented that most of our hormones and our feel-good hormones are produced in the gut.
Oh, really?
Yeah.
I think what's really interesting about this also is I was thinking, okay, well, maybe this is for older individuals, like you were saying on the couch and everything, but this is for everyone. Like this would be so good for children. Like it's a
Absolutely,
practice
it
for
really
life.
would. So
Yeah.
in the clinic, I started teaching. They asked me to teach teenagers
Oh, okay.
who'd come in with highly traumatized and stressful situations.
Mhm.
And these children, for some reason, were not introduced to much sport
Mm.
as youngsters. And I'm talking from 12 to 18.
Mhm.
So their posture was extremely bad. The movements are very simple,
Yeah.
but they really battled.
Wow.
Yeah.
It's foreign
So,
to
and
them.
when I say really battled, you could see their range of motion because now it's in their comfort zone. I'm not asking them to exercise out of their comfort zone. So their range of movement was very limited.
Wow. And they're
Yeah.
teenagers.
And they're teenagers. That was scary.
But finding
That was,
you is a gift. They're early in their life. They can start to implement these things and completely change the trajectory of their future.
yes.
If they
Yes.
keep at it.
Yeah.
Okay, so where can people find you if they want to learn more about KinRe for themselves?
So I have a website, www.kinra, kineticrelaxation.com. It's a bit of a long word.
I'll put the
Uh,
link.
yeah,
Yeah.
thanks. And then during COVID, I had to find a way to keep my patients moving. And so I recorded a number of classes, quite a few classes actually, and I decided to put them in a web app. So I commissioned a developer to do this, and he's done a wonderful job. And so the classes are all on my web app, which is https colon slash forward slash forward slash app.kinrakineticrelaxation.com.
Oh, perfect. We can have that
Yeah,
on the
and you
go.
just sign up, and there is a fee of $30 a month
Mhm.
or $29.99, and I think that's very reasonable for the way that we can for the way that Kinra helps to heal the body.
Yeah. Well, and it's something that it sounds like pretty much everyone can do. And I know people download the fitness apps. I have one. I prepaid for a year and I never do it because it sounds like
Yeah,
so much pain. But if I had something like that, it's part of my self-care routine, maybe before bed or in the morning.
absolutely,
Yeah,
absolutely.
I love that. Okay, well, thank you so much, Natalie, for sharing your story and for just sharing your work with us. If you are
Thank
someone
you.
who's been dealing with stress, tension, chronic pain, or you just feel like traditional exercise isn't working for you, then definitely check out KinRe. And Natalie, one more time, where can people find you?
So
I'll
the
put the link
easiest
on
is
there as well.
www.kinrakineticrelaxation.com. Thank you, Melanie.
Thank you. All right, and thanks for watching Flow with Solaris. If this conversation resonated with you, make sure you subscribe so you don't miss our next guest, and I'll see you in the next one.